This is the discussion of question number 2 for embryology. Uh, Again, we will be focusing at a little bit of a difficult question, not very frequent as such, but still sometimes found in some examinations, and usually it's a sort of a tougher question that you might come across. So, neural tube defects and midline. In this case, it is focused on midline defects. So, what are midline defects? Now, if you can, I'll use the pen. So midline defects. Now, as you know, there's the embryo, and the embryo is in fact it has its right and the left side. What happens is that if you can remember, there's the primitive streak which happens in the midline. The primitive streak is involved in the formation of uh, the three germinative layers in a process known as gastrulation. So with gastrulation, there is the formation of other internal organs. So, however, the for the completion and the development of certain structures, the primitive streak closure or the walls closure has to be there. For this to occur in a very a smooth manner, there has to be certain criteria that has to be met, which is one thing would be the presence of folic acid. Without folic acid, such problems might arise with defective closure. And also sometimes certain environmental factors might trigger this, such as tobacco, radiation, and whatnot, and even alcohol. Sometimes the maternal conditions such as diabetes and advanced maternal age might lead to this as well, where there is defective closure. And in addition to that, there is also possibilities that certain syndromic conditions that are residing within the fetus itself, such as Patau syndrome and even Smith-Lemli-Opitz syndrome, in such conditions, you would see the malfusion of the midline. So, in all these circumstances, what you see is that the structures have not completed its development, and also there will be defects within the internal organs itself. So, starting on, the first statement is about this question asks which of the following statement regarding embryology for midline defects are true. So here, in fact, what they ask are what are the midline defects that you know of. So the statement A gives midline defects such as spina bifida occulta results from incomplete closure of the neural tube. So the primitive streak, after the formation of primitive, there's the notochord formation, then there's the neural tube formation. The neural tube will have uh, the cranial end will involve in the formation of the brain, and the caudal end involves in the formation of the spinal cord. Now, this is present initially as a hollow structure with a split. The hollow structure has to be fused to be complete. This happens in around 23 weeks or so. The completion is depicted by the closure of the midline. The closure happens with adequate amount of folic acid, that you should know. So midline defects such as spina bifida occulta results from the incomplete closure of the neural tube during again a true statement. If you, yeah, this is a spina bifida. You see different types of spina bifida, particularly if the closure is not sufficient enough, you would see spina bifida occurring in different stages at different levels, right? The least would be this. Here the fusion is almost complete. You only would observe a little bit of a hair tuft that is present at uh, the caudal end of the spinal cord. However, this is known as spina bifida occulta, but there are sometimes more greater degrees of spina bifida, such as meningocele and myelomeningocele. Meningocele, you see only the meninges or the covering of the spinal cord going out into the bulge, whereas in many myelomeningocele, you'll see the presence of both spinal cord as well as the meninges, both present within the bulge that is present outside to that of the dorsal wall. So this is spina bifida. Again, a problem, a neural tube defect that arises because of the non-closure, or it is known as a midline defect. Right. This is a true statement. Cleft lip and cleft palate are examples of midline defects caused by failure fusion of facial processes during embryo. Yes, again a true statement. As you see, these are present in the midline. So this is the cleft lip. There could be bilateral cleft lips, and this is a depiction of a cleft palate. So the unification of these midline structures are sometimes hindered by certain conditions which lead to these midline defects. So one such midline defect that you come across is a cleft lip and cleft palate. So practically what they are asking is the examples of midline defects. True. Anencephaly is a midline defect characterized by incomplete closure of the cranial neural tube, leading to absence of major portions of the brain, skull or scalp. Right. So looking forward, this is a condition which is known as the anencephaly. As I said, the neural tube has two ends, the caudal end and the cranial end. The cranial end enlarges to form the brain. If the closure does not happen for the brain formation of the brain and the differentiation, it requires the neural tube closure happening at a correct time. If this does not take place, then of course the development of the brain is somewhat hindered, and most of the time the amount of tissue that is found within the brain is reduced, or will not be sufficient. In such conditions, it is known as anencephaly, the absence of the brain. Again, a problem with the with the midline closure. Holoprosencephaly is a midline defect characterized by failure of the forebrain to divide into distinct hemispheres during embryonic development. This is holoprosencephaly. Uh, Again, a midline defect that leads to the mal-differentiation of the brain, particularly that of the cerebrum. So you would see that it's not functioning well, and the division into distinct hemispheres requires the neural tube closures. Hence, again, a true statement. Then the fifth and the final would be the midline defects such as omphalocele and gastrochiasis result from abnormal closure of the abdominal wall during embryogenesis. Um, Omphalocele and gastrochiasis are both abdominal wall defects. That is true. There are few differences. In omphalocele, initially, before the development of the fetus or the completion of the development of the fetus, you see the abdominal organs outside to that of the uh, body. Later, what happens is that it moves in and gets and rotates. So initially, the these organs are present outside, then it comes through the umbilicus, and the fusion of the midline takes place. This is how the development usually proceeds. Omphalocele is a condition where the contents are covered by a membrane and found, usually the abdominal contents are found outside the abdominal wall, but the the umbilical cord is identified without any problems. However, this is present in the midline. So, but in gastrochiasis, the difference is usually this consists of part of the bowel. Usually in omphalocele, it could be abdominal organs, it could be the bowel, or it could be the stomach as well. But usually in gastrochiasis, this is the bowel, and it is present not in the midline but bit paramedian or lateral to the midline in a paramedian axis. The other difference is that there is no covering of a membrane and the umbilical cord is not to be found attached to the gastrocases. So, omphalocele occurs due to the incomplete closure of the abdominal wall, leading to the herniation of abdominal organs into a sac covered by the peritoneum. However, gastrocaesis is a characterized defect of the abdominal wall, usually to the right of the umbilical cord insertion. And it herniates directly into the amniotic cavity. These conditions are usually managed by means of surgical emphasis. So, the statement is midline defects such as omphalocele and gastroschisis result from abnormal closure of the abdominal wall during embryology. It's not the abnormal closure. Again, it's a little bit of a wordplay. It's not the abnormal, but the inability to close or the hindrance of closure. It's not abnormal, therefore this is a false statement. But it is a again, true. It's a true, midline defect. So this is question number 2. Um, Rather a difficult sort of a question that you come across in embryology. So I hope that you know what a midline defect is and could bring out examples if required. So we'll meet with the third question.